September is Newborn Screening Awareness Month. We're going to hear how one boy is thriving following treatment with gene therapy after receiving an early diagnosis for spinal muscular atrophy, SMA. Today I have Dr. Sandra Reyna, Vice President of Global Medical Affairs at Novartis Gene Therapies, and Hannah and Jim Weaver, parents advocates, and they're going to share their information on the signs of SMA. Good morning to both of you.
Good
Morning.
morning.
Well, let me start off with the parents. Let me ask this particular question. Can you describe your family's journey from Payne's SMA diagnosis through treatment?
Yeah, so Payne's diagnosis was via newborn screening, which actually just started a year before he was born here in Missouri, where we live. And at 6 days old, we received a call from his pediatrician notifying us there was an abnormality on that newborn screening test. It was with his muscles and it was genetic. It was called SMA, and that was really the extent of the information we were given. So we spent the next few days diving in, researching the options for treatment and everything that we could do. And then we went to the local children's hospital, met with a team of doctors, and really sat down and put that game plan into action. And by 6 weeks, Payne had received Zolgensma, the one-time gene therapy, and he was dosed and still continues to be asymptomatic. So he has never shown a symptom of SMA, and that is certainly thanks to newborn screening.
So, Jim, how is Payne doing?
Payne is doing fabulously, as Hannah stated. Pre-treatment with Zolgensma and post-treatment, he has never had any symptoms of SMA. He is now 2.5. We just recently had our 2-year post-Zolgensma appointment with our neurology team. He passed every test that they had given him. And like I said, he remains asymptomatic and he is a little ball of fire.
I can imagine. Now, doctor, what are the signs of SMA?
Right. So maybe starting off with, what causes SMA, right? And we know this is a genetic disease. It's a devastating disease. It's a rare disease, but it's missing a functional survival motor neuron 1 gene. And if you leave these children untreated, it leads to progressive muscle weakness, paralysis, and in most severe forms, permanent ventilation or death in 90% of children by age of 2. So the early signs of SMA can be subtle, with children sometimes appearing healthy, even as motor neuron loss is occurring. So many primary care physicians and pediatricians don't recognize early signs of SMA, and this can lead to delays in the diagnosis and treatment. Though SMA is rare, 1 in 54 people are carriers of the disease, and it affects approximately 1 in 10,000 births worldwide. So as of July of 2022, we have 47 states that are screening for SMA at birth, which is absolutely tremendous. It's nonetheless important to understand the signs of SMA in newborns and be aware of available treatment options. For parents in states that do not screen at birth, it's important to watch for early signs like muscle tone, difficulty, breathing, and feeding.
Now, Hannah, what made you want to pursue the gene therapy option?
When Payne was diagnosed, there was 2 treatments available. One stopped the progression and one slowed it down. And for us, we wanted to go with the option that was one time, which is the gene therapy, and that stopped the progression in its tracks, which for us, Payne, of course, like I mentioned, did not have any symptoms of SMA. So we wanted the one-time treatment, the one that would really just target it and allow him to continue to grow asymptomatically.
Now, Jim, what do you look forward to next as a family?
What we look forward to the most is continuing to watch Payne progress. We really enjoy he and his brother. They have a great relationship. We love watching him progress as a normal asymptomatic baby. And we also look forward to continuing to advocate for the education and awareness of SMA.
And also look forward to him being a little fire plug, right?
Yeah, that's right.
Now, doctor, aside from newborn screening, how else can parents learn about SMA?
To learn more about SMA and carrier screening, you can visit puresma.org.
Dr. Sandra, Hannah, Jim, thank you so much for joining us on Morning Blend.
Thank you.
Thank you.
Thank you.